Welcome to COIQ, where you learn how health innovators maximize their success. I'm your host, Dr. Roxie, founder of Legacy DNA and international best-selling author of How Health Innovators Maximize Market Success. Through candid conversations with health innovators, early adopters, and influencers, you'll learn how to bring your innovation from idea to startup to market domination. And now, let's jump into the latest episode of COIQ. Welcome back, COIQ listeners. On today's episode, I have Yossuf Albanawi with me. He is the CEO and co-founder of Believe. Yossuf, welcome to the show.
Good morning, Dr. Roxie, and thanks for having me. It's a pleasure to be here and really excited to dive into it.
Awesome. I'm glad to have you here as well. So I always like to start off with giving you an opportunity to share a little bit about your background and what you've been innovating these days so we can kind of give some context for our conversation today.
Thank you. Yeah. So as you said, I'm the co-founder and CEO of Believe, which is a digital health solution focused on improving medication safety. And our first solution is a system that consists of a smart and secure pill bottle, a mobile app, and a dashboard that helps prevent opioid abuse and addiction. And so we're a 3-year-old company, and right now we're beginning to commercialize our device with pain management clinics across the US. So my background is worked previously at a rehab center in healthcare, served on opioid task force in North Carolina before starting the company. And really what opened up the door was first a personal experience that I had with addiction, had gone through it myself when I was younger, and also experienced firsthand the effects through my work. And just realized that there was a huge gap between prescription and addiction. And although controlled drugs do a lot of good and benefits to patients, they also come with unintended consequences. So how do we ensure that our patients are healthy and free of addiction and stigma?
So, I think that it's interesting because innovators, I think, come to the, the idea that they're going to build something for a number of different reasons, right? Some of them are technologists, engineers, physicians. And so what I think is so fascinating about your story is that you've experienced the problem firsthand. How do you think that impacted your, your strategy over the last few years? How that's made a difference?
That's a great question. I believe that, first and foremost, in starting any company, the passion and the why and the purpose, in my opinion, is so important because, success doesn't happen overnight. And, we're 3 years into it, and I really believe we're still, scratching the surface. There's so much that's still to come. And so had we not been grounded in our mission, it's not just me, everyone on the team, I think we were very purposeful, my co-founder and I, in selecting not only ourselves, being aware of who we are and what we're bringing to the team, but also the people that came next. And so every one of us has a personal story with the problem that we're solving. And, of course, that's not the end and be all, but
right.
We really believe that passion and purpose is a true driving force, at least in our company. And so from experiencing myself, I believe that I was able to have a grassroots lens at the problem. And I think in healthcare, typically, at least most of the companies out there, start at a very high level. And so at Believe, we started, at the grassroots level and worked our way up. And I think it's interesting. I don't think one is right and the other wrong. I think it's just the way it is, at least in our company. But we've done really good at filling in the gaps. So we have a large clinical advisory group. Our executive team, has decades of experience in healthcare and pharmacy, the clinical space, the pharma space. And so and of course, the technology and product space. So as a team, we've built a solid team, but it all started with a story.
Yeah, which is a great place to start. Statistically, the number one reason why organizations succeed, startups succeed, is because they've figured out product market fit. And I really feel strongly that one of the major pathways to that product market fit is starting off with the customer, and involving the target customers in that co-creation process. And so I can see how your personal experience and the personal experience amongst your team made you really close to the customer from day one. And I imagine that would definitely lead to your success.
Thank you. And I will preface and say that I completely agree with the point about customer discovery. Unfortunately, oftentimes it's overlooked, when I talk to other startups that are starting out, and, it's never, let's say, it's never for a lot of people, it's not as exciting as it should be, because you feel like you're not really moving forward, but in reality, you're essentially saving yourself a lot of hard work and failures in the future if you do it early on. And so the first year actually for Believe was pure customer discovery. My co-founder and I did not build a single thing, did not put in a dime of money until we really felt confident that what we were going to build was actually going to be purposeful and clinically used. And so, hopefully we'll dive into this, but we have a, three-pronged approach in terms of our users. So, we have several users, several customers. And so we had to spend a lot of time, identifying the patient, end user, identifying the physician, who's our main customer, and then the pharmacist. And so, it takes a lot of time to build that. And I believe that we've done a lot in the early stages, and now can, reap the benefits of what we've produced.
Yeah. I love what you're saying here, because even though you and your other, co-founder might have had firsthand experience, whoa, that's never happened. My phone just rang. Didn't power it off. Let me just do that really quick, so we don't have this happen again. So your co-founder and you had personal experience, but I think what I'm hearing is that you said that's not enough. Just because we have personal experience doesn't mean that our perspective is reflective of the entire target market, so that you went beyond that and involved other voices in that experience, in that customer discovery process, just to make sure that you were going to build something that was going to be commercially viable, not just to you and your co-founder, but for an entire target market.
Exactly, 100%. And my co-founder's his name's Gautam, and his background's in biomedical electrical engineering. So he's the product person on the team, amongst many other things. But that's another major thing. That's another major asset that I believe every startup today, every tech startup has to have. And so, and so to your point, yeah, exactly. It's not enough. And I think we spoke with at least 100 physicians, pharmacists, patients over the course of 6 months, and just spent a lot of time talking, getting feedback. And not looking at it from, or trying to eliminate as much bias, I guess, out of it as well.
And that's the key word, right? The bias, because it's really easy to have that bias, and that, leads you down the wrong path. Mm-hmm. So what do you say to other innovators that are in the trenches right now? They're probably at that crossroad of deciding, ooh, I have a limited amount of money. I have a window of opportunity. So, time is a scarce resource too. Maybe I should just circumvent this customer discovery co-creation process, or, just ask one or two people and then move on, because we don't have time and we don't have money for all of that. We need to get to market. We need to start getting paying customers. What do you say to them, kind of as you're looking back into what your experience has been and what's led you to your success today?
Yeah, great question. It's very tempting, as you pointed out, it's very tempting to jump this process. And I would say that it will save you a lot of time if you don't. if you just spend time being patient. And healthcare is, as you may know, Dr. Roxie, in my opinion, is an irrational market in the sense that it's slow, and then, at one point it just picks up. And so COVID is a great example. We've had telehealth for the last 20 years, but now we're seeing, a huge growth spurt. Why is that happening? And so I personally, there's a few answers. I don't hold the answer, but I think my view on it is it's irrational and it takes time. And so unlike other sectors where, maybe growth and go to, a first market advantage is key. In healthcare, I believe that if you don't take your time understanding your customers, you're just going to hit a dead end. You won't be able to commercialize. There are so many great examples, especially in our space, the medication adherence space, of companies that just thought that how great would it be to, get reminded when to take your med, or figure out if someone, it's a great solution on paper, but does it really meet the needs of customers? Are people willing to spend money on that? Clearly, no. There's something there that we're missing. And so that's why we have a very unique advantage and a very unique position. We're not really an adherence play. We're a preventative play. It's all about risk mitigation. So that's a clear kind of need on the physician side. And so they're much more eager to use us. And so it wouldn't have if we didn't spend enough time understanding that, I don't believe we would have been able to get the traction that we're getting. And so for you to be able to get there, I really believe you need to put in the work early on, and talk to as many customers as possible, and then pivot. It also allows you to pivot. If you realize 6 months into it, I don't think there's a business model in it, then, you didn't spend a lot of money, you didn't spend a lot of time. And then finally, get a co-founder. I really believe that in healthcare, that the team is so important, especially it's so crucial to have a diverse team of skill sets and background, and get advisors as early as possible. I'm not in any way a healthcare veteran, especially before starting Believe. I'm a very quick learner, that's for sure. Both my co-founder and I pride ourselves with that. And I think that has helped us through customer discovery. But I really believe that if we didn't have the mentors that we did early on, I was being mentored by, a very well-known pharmacologist and a researcher in the addiction space while I was at Wake Forest. And had Dr. Johannes not been there in the early stages, it would have been much harder. And so find a mentor and find advisors as early as possible. You'd be surprised by the amount of people in healthcare that are willing to support new endeavors. It's a great space.
Yeah. Well, and I want to go back to something that you said that I, just kind of want to shed a little light on too, and have you go deeper. What I hear you're saying is not only did the customer discovery allow you to, be closer to the customer and making sure that you were building something that they wanted and they need, and who's willing to pay for that, which obviously is extremely critical. But also it sounds like you discovered your competitive advantage, because to what you were saying, the medication adherence, technology market is very, I don't know if I would say saturated, but they're kind of a dime a dozen. And so it would be really easy for you to come out, do all that work with a Me Too product. But through this process, you were able to figure out where you could serve, where could you meet a need in an underserved part of the market. And I would imagine that that's, definitely leading to your success.
Yeah. You said it. I believe it's actually a graveyard. Unfortunately, there's probably one or two companies that are pioneering, and so I
agree. Lots of great stuff out there that no one's using.
But to your point, we had a lot of assumptions.
Yeah,
I would say maybe 60% of those assumptions were disproved. And then 40% were like, oh, we were onto something. Let's, and so I think it's a balance, right? Look, most founders will have a gut feeling. And I think that is innate in a lot of founders. And so follow your gut, follow your intuition. Don't second guess yourself too many times, but have an evidence-based approach. starting a company is, in my opinion, is like a scientific research. You have a set of assumptions and you're trying to either prove them or disprove them, ideally disprove them. And if they're not disproved, then at least you can say that, yeah, I've done my research and it's vetted. And I really believe investors will look for that. Eventually you will get asked the question. And so if you don't do the hard work early on, you're trying to fundraise right now, and you don't have these assumptions figured out, it's just going to be very, very difficult.
Yeah. Yep. So let's go. I think you have a very interesting story on how you found your co-founder. So tell us a little bit about that.
Yeah. So Gautam and I were not childhood friends. We did not, meet in Palo Alto or start a company in a garage. It was actually a coffee shop. But it's very interesting. I think it's very unique. I'd come up with the idea behind Believe in my senior year of college. And, I'm not an engineer. I'm not a developer. Like I said, I was just really passionate about it. And I was actually going into trying to pursue law school. And, luckily, after working with a lot of lawyers over the last 3 years, I can say that I don't regret that decision. And so decided that in the summer of my graduation, I wanted to pursue Believe full time. And so luckily, Duke University was very close to Wake. It was only an hour and a half drive. And, I decided to make a few trips out to some universities that had really good engineering and tech schools. And so Duke was one of them. I printed out a bunch of ugly looking flyers that were haphazardly made, but they did the job. Yeah. And, was looking for engineers. And so this is something that I learned in one of my courses. It's called bait and switch. So you have an attractive offer, and then hopefully get that person to the table and then show them, try to guide them into the better one, ideally. Yeah. And so, I'd gone to Duke and then posted several flyers, and one of them was in a coffee shop there. And my co-founder Gautam at that point was teaching an engineering course for high schoolers. And so he was on campus, probably the only person on campus because it was dead. It was between summer 1 and 2. Long story short, he passes by the coffee shop. He doesn't drink coffee. He's not a coffee drinker. He never passes by that coffee shop. But that day, he wanted to, I think, get something for these kids, at the coffee shop, and saw the flyer, took a picture of it, and then left. And so he came back that same day just to, check up on it to see if it was still there. It been taken down by the coffee shop owner. So had he not, taken that picture, who knows? Wow. So, we're that experience shows just like the values that we have as founders and as a team. We're very spiritual. We, believe in fate. We believe that certain things happen and you just have to go with your gut, go with your intuition, and see it through. And so he texted me. I drove back up, I think 2 weeks later, met at a coffee shop. He had some tea. I had some coffee. I'm a big coffee drinker. And then that was when he shared his experience with addiction. Some of his family members had gone through it, and actually some lost their lives to it. And so that really resonated with me, and just felt like we had a vulnerable moment. And at that point in time, I feel like we just connected. And, from there, you don't meet a person and then decide to start a company with a random person, but I guess it just worked out for us.
Absolutely. Yeah, that's great. I think that's probably a story that you'll tell for many years to come.
We hope so. Yeah.
Hey, it's Dr. Roxie here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
Yeah.
So when you think about where you are today, and kind of in comparison to that coffee shop encounter, what's this ride been like these last 3 years?
Wow, it's been crazy. I mean, we've lived in 4 different cities across both coasts. We've moved. We literally packed up our bags 6 months after meeting each other, moved to DC, part of a fellowship program called Halcyon, based in Georgetown. It's for social entrepreneurs, and moved to Boston to Mass Challenge, then 500 startups in San Francisco, and then back to DC. And so it's been a crazy journey, you know, and I believe that. Unfortunately, we don't talk enough about the downs, because it's not just, you know, it's not just success. I think most of the time, it's 90%, in my opinion, it's 90% small failures, and then that leads to success. And so we highlight the success part, but not enough on the hardship. And so, you know, we've had to make a lot of sacrifices, but it pays off. And so over the last 3 years, you know, we've grown the team to plus or minus 20 right now. And so it's not anymore just me and Gotham. It's much bigger than that. And we want to continue to do that over time. In my opinion, as much as I can dilute my value to the company, the better the company becomes, because eventually it's not me, it's not Gotham, it's a mission. It's much bigger than ourselves.
Yeah, absolutely. You know, I completely agree with you. I think too often entrepreneurs think that in order to get the right mentors, the right investors, the right target customers, that they have to present a very rainbow butterfly kind of journey. We got it all figured out. We got all the data. We got all the customers. We got all the money kind of story. And I've interviewed 200 plus entrepreneurs, and none of them have had that story. And I'm, you know, because it just doesn't exist, right? The reality is much more complicated and difficult than I think a lot of us tend to admit. And there's so much discouragement along the way. So what are some of the things that you've done to stay encouraged over the years?
Yeah. You know, I think 2 things. I believe that you have to have that inner, you have to always look inwards when you're going through a tough period of time. You know, for example, over the last 2 years, I think at every year there was a major crossroad, at least one major crossroad. And that could have been honestly, the death of us as a company. I think the first year it was, let's say, the lack of traction. Healthcare is very, very slow. It takes a lot of time. We're newcomers. How do you get people to believe in you? How do you get people to try, you know, to take a risk, a leap of faith? And so in the beginning, it was very little traction. And so, you know, try to look inwards and just think about why we even started this. I would say second year, co-founder relations, you know, we've known each other for a year plus.
Yeah,
we're still in this journey where we haven't even gotten started. And there's a lot of pressure. You know, I moved to San Francisco to fundraise. Gotham was here in DC. And so 6-hour difference, a lot of things being lost in communication. And it was just us and maybe another person, but mostly us. So we're literally, you know, seeing each other virtually every day. And so if you don't have that break, if you don't have, you know, a good structure in place, it could be very, very daunting. And so had to learn new skills, new communication skills, learn to be better founders to each other. So that was a major crossroad. You know, now early pilots, commercialization, bugs, glitches, product issues, you know, patients coming on board, churning, improving, then going back to the drawing. And so, you know, I think this will continue until you get to a point where, at least it's on autopilot and you've figured out a lot of some of the issues that are going on with the product or especially with product market fit. And so, I think the way we continue to move forward is we be better team members to each other, be vulnerable when we have to, but also work towards being better people.
Yeah.
And then looking inwards, I had a very tough moment about a month ago. I'd lost a very close family member of mine, and it's a very tough time for everyone. I mean, COVID has really, really changed the world. Mm-hmm. But I really believe that I was able to see a silver lining in all this, and there's a lot of positive things that are going to come out of this. And so looking inwards and just trying to stay positive and asking yourself, why did you even start this? And so it goes back to the first point I made, which is passion. I really believe if you don't have that, and if you're just chasing the money, the impact, the recognition, especially for first-time founders, it's just not enough. And so you need to really ask yourself why you're doing this. And if you don't have the answer, that's fine. Go back, do your thing, work at a normal job. You'll probably get paid much better.
Right.
And stability. So, and then, when you find your calling, go for it.
Yeah, that's great. That's really great wisdom. And, thanks for being so transparent and vulnerable. And, I think that co-founder relationship is really just like a marriage, right? And so when things are not going well, right? When cash flow's not coming in, when you're experiencing all the things that you just iterated, it would be really easy to blame the other person. It's also really easy to start questioning of like, is this even worth it? And am I really onto something? Am I, are we ever going to get there? All of these questions that you tend to ask yourself as you're going through this journey. And I think that's why we have, so many people that enter, and so many people that don't finish the cross line, because this journey gives you 10,000 reasons to quit. Right? Yeah. You've learned a lot over the last 3 years, and you've created some momentum recently. And, so let's talk about how COVID has actually been a little bit of that catalyst or momentum for you. And what are some of the highlights that's happening now, and, how you're successfully commercializing Believe today?
Great question. So to start with, early this year, we were able to finally launch our first commercial product and have it right here in my hands. And so we're very, very glad to finally see it come to fruition. It's great to, hold something. Hardware has its value, although it's a long, long journey. When you're getting there, at least you can, actually see it, engage with it. And it's a great way to also get people excited, customers, investors. When we send this device out, it really speaks for itself. And so we've gotten a lot of good feedback, good data from the market. To be honest, I don't want to rave too much about it, but most of the feedback that we're getting is warm. They love the ease of use, especially on the app side, how easy, how patient friendly it is. On the pharmacy side, it's so easy to dispense in the device. It's literally the same process as they would normally do, just replacing a traditional cap with ours, and then it's just a locking sleeve that locks everything in place, and it's ready to go, tamper evident and secure and safe. So this is the first piece of momentum that pushed us forward. We're able to launch a few clinical pilots, got some really good clinical data from patients, several patients have been on it for 6+ months now, really good data, and continually improving. The team that are behind this door that I'm in are literally right now working on updating the firmware, testing out the devices, improving the app. So it's a continuous journey. And I think seeing that during COVID has been huge, because COVID allowed us to do two things. First, internally, we were able to. There was an initial slowdown in our go-to-market strategy because, of course, with hospitals, everyone was prioritizing, the at-risk populations. So we were able to do a lot on product, and that's just one area. Operations, our CEO came in, was able to really build new foundations and layers to our company. Just created more stability, more structure necessary for future rounds of funding and expansion as well. We're able to enhance our onboarding protocols. This is a big piece of it, because with any type of digital health solution, you're dealing with a patient, and if you don't have the right onboarding protocols, there's going to be a huge churn, right? And so, and that's something we realized in our first pilots. We had patients coming on, but a lot of them were churning. Why were they churning? So we're able to take all this feedback, improve it, and now we're seeing the benefits that we've, and all the time that we spent doing that. So COVID allows us to do all these things internally. Externally, I really believe it's the last month has really showed what the future may look like. Telehealth allowed a lot of providers to first be more comfortable, in my opinion, using technology, also seeing the benefits that it could bring, right? And so a lot of people were skeptical, including myself. I was never a big, I would say, I always feel like as a patient, seeing a doctor is powerful. It has its perks. But at the same time, during these tough moments, we have to adapt. And so telehealth can augment that. I don't think it's a complete replacement, but it augments the relationship. And so similarly with remote patient monitoring, a big trend is moving in that direction. We're seeing increased reimbursements from public and private insurance companies. That shows that first, it's medically necessary, and second, they're willing to pay for it. And so that's a big part of it. And I think,
yes.
finally we're able to see this. And I think two things. I think you need to do the customer discovery part. You need to figure out, we always had the assumption that payers were going to be a prime customer. But again, healthcare, in my opinion, is irrational. And so you want to make sure that you're able to stay alive long enough where you can reap some of the benefits that growth may come with. And so this is a good example. I think that it's not purely luck. I think it's a mixture of right timing as well as really understanding the market that you're playing in. And so we're hearing from a lot of providers that this is a tool that could really help with the way they prescribe controlled drugs. And it's not just opioids. Opioids is a starting point. They envision a world where other drugs like gabapentin, benzodiazepines, which are like Xanax and Klonopins, they're being labeled now as a silent epidemic. And so we see ourselves as kind of creating a standard for controlled drug prescription, dispensing and monitoring. And so, we have a number of partnerships with major hospital centers across the nation, including the likes of UW and OHSU. And right now we're rolling it out with several of their providers, and it's an exciting time, and we've recently launched a new campaign that has resulted in a lot of inbounds and increased conversion rates. So, I think, again, it's a mixture of timing and just providers feeling more comfortable using these technologies.
Yeah. So I want to give you an opportunity just to kind of speak to this as we, start to wrap up here is, one of the things that I've witnessed with COVID, besides the silver linings that you're talking about with, reimbursement alignment and greater adoption, accelerated adoption of this digital health tools, is that the inbox as the conferences has closed, as the planes have been grounded, right? There's been this huge shift towards digital communication. And so for many organizations, we were already developing digital communications and campaigns, but because there's been a huge shift, because that's almost the only channels that we have now to engage, the amount of noise and clutter is exponentially higher and made breaking through the noise more difficult than ever before. So what are some of the things that you all are doing to successfully break through that noise and get the attention of your target customer?
That's a great question. Over the last, I would say 6 months, we have probably tested anywhere between 10 to 15 different types of campaigns. And so, the concept of A/B testing is very big in Silicon Valley, and they've championed it for the right reasons, because it's all about data. And I think as a team, we have that approach. We it's not about ego. It's not about who's writing the content,
right.
what role they're playing. At the end of the day, if it's not tested, it shouldn't be used. And so we're able to do small tests to basically improve the content, and we track everything from open rate, click rates, reply rates, whether they're warm, whether they're cold. And literally the first, I would say, 5 campaigns were very cold. And so to your point, there was a lot of noise. I think the timing as well, March to June was very tough. Not only COVID, but people, the anxiety that came with, and uncertainty. Yeah. And so how do you essentially take in all this information and address it and improve on your content? I think it's trial and error. We took what worked and we left out what didn't. And so anything, between subject lines to the way that we talked about Believe. So right now we see Believe as, a tool that essentially fits into some of the, I would say, measures coming out of COVID, especially on the DEA side. I think that's a big piece of it. The DEA has eased prescriptions for controlled drugs because they want to limit, of course, the risk and the exposure that patients are getting when they visit doctors. So as you know, a lot of pain patients that are prescribed opioids have to, visit the doctor every month in order to get a new refill. And they administer anything between urine screens, questionnaires, to basically figure out if that patient is at risk. And so they can't necessarily do that as much with COVID. And so there was a huge policy that was pushed out by the DEA to essentially increase these prescriptions to 3 months, as much as 90 days. And so, that may come with unintended consequences. So, how do we essentially fit into that? We ensure that the way we talk about Believe fits into some of these policies, essentially creating more safety, reducing the risk in that process. And, also kind of talking about the benefits of using remote patient monitoring during a COVID world. Yeah. You don't have to bring the patient back in to administer these things. We'll do most of the automation in the back end. We'll make sure that the patients that are at risk will be front and center, and the ones that aren't, you don't have to worry about them. You can get the peace of mind. And for a lot of providers who see hundreds of patients a year, you can't necessarily track every patient. It's just too much. And so that's another big issue around medication adherence, which a lot of companies haven't solved for, which is the noise.
Yeah.
Data. There's too much data being pushed out there. And how do you ensure that providers act with as little data as possible, in my opinion? So I think that was some of the content that we were able to create.
Yeah, that's great. So is there anything else that you would, any wisdom, any lessons learned in your last 3-year journey that you would want to share with our viewers and listeners?
Yeah, no, I first thank you for giving us a platform and also creating this podcast, because, to your point, it sheds light in a genuine way and also stresses the importance of business model validation, proof of concept, product market fit, especially in healthcare, because it's so hard to commercialize, and it's so hard to really find product market fit because everyone points fingers. Insurance company points finger to the provider points a finger to the pharmacist to the, and so on and so forth, because there's so many actors, especially in our market where we have to adapt to every single one of them. If you're selling to a provider group and it's a clear path, that's a different story. It's much easier, but especially when your end patient is not your customer, it's very, very tricky. So I think, words of wisdom is, we're 3 years into it. We haven't, I believe, still scratched the surface. There's a long way to go. We're very excited about the future. And so it's a long journey, try to envision a world that you and your team sought to create, and use that as your North Star. And then tap into resources as early as possible. You don't hold the answers, the world does. And so I guess be humble in your approach, and to your point, reduce the bias and the noise.
Mm-hmm. Excellent. Well, thank you so much for joining me today. I appreciate you taking the time to share your experience with everyone. How can our listeners and viewers get a hold of you if they want to follow up with you after the show?
Yeah, follow us at Believe.com. There's, you can get a bunch of information about what we're doing. And there's a contact us button where we'd love to just hear your story, get your feedback. Is this something that you've been through, a friend, a family member has gone through? We'd love to just hear your stories. That's what motivates us. That's what keeps us going. And that's our energy. That's our fuel. So, check in and let us know your story. And if you feel like there's someone in your network that could benefit from this, reach out to us via our website. We have a contact us button, and we'll reply as quickly as possible. We're a startup. We're always checking our inboxes.
Awesome. Thank you so much. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and your attention. To save time and get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who's been sharing the show with friends and colleagues. See you on the next episode of COIQ.